Hello everyone.
Let's talk about effect of stroke. It's a very important topic with respect to the NEET PG as well as the other, even in the theory part of the medicine. So we all know what are the effects of the stroke, like whether it is a cerebrovascular accident or stroke, a person will get certain type of symptoms. But in NEET PG, they question about, like say, they will provide certain symptoms, collection of the symptom, and then they will ask you what is the name of that collective symptoms, syndrome name, or which artery is getting affected. So we will try to cover it up. But before going to that thing, let's have a brief overview regarding the blood supply of cerebral hemisphere as well as the brainstem, so that it will become very easier for us to understand the thing. So if we look at this one, cerebral hemisphere, this anterior cerebral artery, it supplies mainly a medial aspect of cerebral hemisphere, and this medial aspect in in motor as well as the sensory homunculus, this is the lower limb, right? The lower limb. So it means if there is anterior cerebral artery lesion, there will be lower limb getting affected. Similarly, the middle cerebral artery, it supplies mainly the the lateral aspect of the cerebral hemisphere. And the lateral aspect of the cerebral hemisphere is the one which in motor homunculus as well as the sensory homunculus involves upper limb and face, right? So if there is any lesion of the middle cerebral artery, upper limb and face will get affected. And posterior cerebral artery, it supplies mainly the posterior most aspect or the inferior aspect of the cerebral hemisphere. So it's very easier to remember. The posterior cerebral artery, mainly there will be only one type, like say we can say the one symptom, characteristic symptom, that will be if this part is getting affected, there will be contralateral hemianopia. Contralateral hemianopia with macular sparing. Why the macular sparing? Because the part which is getting represented in the macula has got the dual blood supply. If there is lesion within the posterior cerebral artery, middle cerebral artery, blood supply is intact, so there will be macular sparing. So it's very simple for the posterior cerebral artery, but with respect to the anterior and middle, we will discuss in coming slides. Now, if we look at this from the lateral aspect, the same thing. This supplies the lateral surface. This is the middle cerebral artery, and which represents our upper limb and face, right? And if we look at the medial aspect, the anterior cerebral artery, which supplies the anteromedial, this part, and this represents our lower limb, right? And the posterior cerebral artery is the posteriormost circulation. In anterior circulation, first and foremost is the middle cerebral artery, which supplies mainly the lateral aspect, right? The lateral surface of the cerebral cortex. So the three main area which is supplied by the middle cerebral artery is motor and sensory cortex on the lateral aspect, and lateral aspect is the one which represents upper limb and face. So because there is a motor cortex involvement, there will be the paralysis. Because there is also the sensory cortex involvement, it means sensory loss. So paralysis and sensory loss of the upper limb and face of contralateral side. That will be the one symptom, right? And if we look at this one, like say, just imagine the lateral aspect of the cerebral hemisphere. So it is mainly constituted by the temporal lobe and the frontal lobe, which has got the middle cerebral artery blood supply. So there will be involvement of the temporal lobe. If it is dominant side, which is usually the left side, there will be aphasia. And if we can recall, temporal lobe is where there is Wernicke area located. So there will be Wernicke aphasia. If non-dominant or the right-sided middle cerebral artery is getting affected, then on the right aspect of the temporal lobe, that lesion will result into hemi-neglect. And within the frontal lobe, Broca's area is getting affected. So the person will have three symptoms in middle cerebral artery syndrome or middle cerebral artery lesion. One, loss of sensory as well as paralysis of the upper limb and face of contralateral side, opposite side. That's the one. Second thing is, if there is left-sided middle cerebral artery getting affected, then there will be Wernicke aphasia. If the right middle cerebral artery is getting affected, there will be hemi-neglect. And the third one is Broca's aphasia. Now, Wernicke and Broca's aphasia, we are very well aware, like in the Wernicke aphasia, what happens? The patient who suffers from the Wernicke, that is a receptive aphasia, right? Receptive aphasia means the person don't have insight. There will be the word salad, and whatever he will be saying, it will make no sense. And Broca's aphasia means the person who suffers from this one will have intact insight but won't be able to say the word. So if we get any kind of the, like say if we are getting a question or vignette in which the patient presents with say left-sided upper limb and face getting paralyzed, as well as there is loss of the sensation, and the person is not able to understand what the question is being asked or is not able to answer the question, then your, like say, pinpoint diagnosis should be middle cerebral artery is getting affected. As well as, because within the temporal lobe, if we can recall, there is Mayer's loop going, right? Which is the lower part, which represents the lower part of the retina. It goes to the occipital cortex. Occipital cortex. So, lower part of retina means in the field vision, upper part, upper quadrant nopia. That is known as a pie in the sky in the contralateral aspect. Okay, contralateral aspect. So, in conclusion, we can say the middle cerebral artery lesion will have contralateral upper limb and face paralysis as well as sensory loss. That is the one symptom. The other one is Wernicke aphasia, and the third one is Broca's aphasia. So, not making it too complicated, just remember aphasia and contralateral face and upper limb paralysis and loss of sensation. So your diagnosis should be most probably middle cerebral artery. Now coming to the second one, the anterior cerebral artery. Now the anterior cerebral artery, as we know in the previous slides, it represents or it supplies the medial aspect of the cerebral hemisphere, like this aspect. So the motor and sensory cortex, which represents medial one, the lower limb. So there will be the lower limb paralysis, as well as there might be the person suffering from urinary incontinence. So it's very easy to remember, like say, kind of mnemonic you can say, the person who suffers from the anterior cerebral artery lesion is not able to pee anteriorly, like we can say the stream of the urine won't fall anterior, right? Won't fall anteriorly. It will be falling on the lower limb itself. So the lower limb is getting affected and the person is not able to maintain the continence of the urinary. There will be the wetting of the lower limb. So lower limb paralysis as well as loss of the sensation too will be there because both the motor and sensory cortex is getting affected. That is the anterior cerebral artery. Now coming to the third one, lenticulostriate. This is the most common. Most of the patients who suffer from the stroke, they get affected by the lesion within the lenticulostriate artery, and it supplies striatum and internal capsule. Striatum is caudate and putamen. That is the basal ganglia, right? These basal ganglia thing, and the internal capsule is getting affected. So in this one, who suffers from the lesion of the lenticulostriate will have contralateral paralysis. Contralateral half of the body paralysis will be there. And there won't be any cortical sign as it was in anterior cerebral artery and middle cerebral artery because the cortex is not getting affected. So there won't be any neglect, there won't be any aphasia, there won't be any visual field loss. So lenticulostriate artery lesion will affect striatum and internal capsule. So there will be contralateral paralysis. So that's why it is also known as pure motor stroke. No sensory symptom, only motor paralysis. So if in a question, the patient presents with one half of the body complete paralysis, then you should suspect that that person is having lenticulostriate artery lesion, in fact, within this one. And this is quite common. There might be a history presentation, like a person who suffers, who is having chronically hypertension and which is unmanaged or uncontrolled. The patient is not on any antihypertensive medications, So definitely it will result into the lacunar infarct in this particular area due to hyaline arteriosclerosis, that is also known as lipohyalinosis. So your diagnosis should be for the question chronic hypertensive patient who is not regularly taking antihypertensive medication, present to the emergency ward with one half of the body paralysis. So you should pinpoint your diagnosis as lenticulostriate artery. So now we can say anterior circulation, middle cerebral artery, anterior cerebral artery, and lenticulostriate artery. So in middle cerebral artery, there will be involvement of face and upper limb, right? Face and upper limb. In anterior cerebral artery, lower limb. And in lenticulostriate artery, pure motor paralysis of contralateral half, right? So that is a lenticulostriate. Middle cerebral artery, face and upper limb, both the paralysis as well as sensory loss in contralateral side. And in this one, anterior cerebral artery, contralateral lower limb paralysis and sensory loss. Along with anterior cerebral artery, lower limb, we made some mnemonic kind of thing, urinary incontinence, right? And in the middle cerebral artery, there will be aphasia. It can be one aphasia, it can be Broca's aphasia, or it can be both. If it is on the dominant side involvement. If it is the opposite side, then there will be hemi-neglect, right? Hemi-neglect. Hemi-neglect. There, in some of the patients, there might be pie in the sky, visual field loss. So that's very easy to remember. Middle cerebral artery, face, upper limb, paralysis, and loss of sensation on contralateral opposite side. Aphasia and hemi-neglect might be there, might be pie in the sky kind of vision loss. In anterior cerebral artery lesion, lower limb contralateral opposite side having sensory loss and paralysis as well as urinary incontinence. In lenticulostriate artery, which is quite common, there will be pure motor paralysis of contralateral opposite side of the entire body. Now coming to